Okay. Okay. Hi. My name is Anayeli Martinez Benitez, and today I'll go to present our research title in silico study for the simulation of nicotine-induced pulmonary microinfarctions. Uh, this work was developed in collaboration with Dr. Rafael Izazaga, Dr. Leopoldo Altamirano, and la doctora Raquel at INAOE, Instituto Nacional de Astrofísica, Óptica y Electrónica. The main goal of this study is to explore how computational simulations can be used to understand lung microinfarction caused by nicotine exposure. So we know that the tobacco use is still one of the most critical public health challenge worldwide. So the nicotine exposure plays a central role in the development of cardiovascular and pulmonary disease. One of the lesser known consequences is the pulmonary microinfarctions, and there's a small vascular blockage in the lungs that reduces the gas exchange and increase the vascular resistance and the matched tissues. So clinically, they are very difficult to detect these conventional imaging techniques like tomography. So for this reason, or propose the in silico simulation using computational fluid dynamics or CFD to modeling the blood flow and obstruction factors. And this study this process is a safe, ethical, and cost-effective way. So how we can do that? So to we're gonna use this methodology, and this method allows us to model blood flow inside the pulmonary vessels. So taking into account the physical change induced by nicotine, increase the viscosity, reduce the vessel diameter, and higher rate of clot formation. So we triggered real-world data from two important databases. The first database is Enhance, which contains the health and smoking information, and the other database is MIC5, and which provides clinical parameters such as blood pressures and rate hair. And we gonna do the simulation in FD. And finally, we compared the two groups, the chronic smokers and non-smokers, in order to analyze the impact of nicotine of blood flow and health risk. And for the data, because we use two data sets, we have this methodology, and we're gonna process in the all data, and the QC system take the most important data of these two, and we have a one data set. Sorry. Mm, Well, in the results, we have our simulation that show a clear difference between smokers and non-smokers. For the chronic smokers, uh, blood viscosity was significantly higher and leading to slower flow inside the vessels. For example, the results that we have for the classification, we opted for put three risks: medium, high, and low. And this is the data that we obtain. And if the patient is smoker or not. And in the other images, we can see that the precision that the user system is like in low 98, on the medium 93, and the high 84. And the accuracy that we have in general of the program is the 0.95, and what we say that is very good for the program. And we're gonna do these data for use to analyzing the risk that we have a microinfarction or clot formation. And after that we have the graphics like this. in this graphic, we simulated the pressure distribution and the planetary activation with nicotine. Well, in this slide, we can see that the for smokers, blood viscosity was significantly higher, leading to a slower flow inside the vessels. We also observe a steeper pressure gradient, which indicated higher vascular resist and increased the risk to micro occlusions. Well, this model able to identify the specific regions where clots are more likely to form areas in high viscosity and low pressure. So when we can to compare these results with the clinical results, we want to start consistency, which validated the accuracy of the simulation that I show you us in the slides. In the slides, right, sorry. And this suggests that the computational modeling can effectively reproduce a real physical difference between smokers and healthy subjects. And this is really fascinating because I think that with this data we obtain, we can take the simulation that I know that this in this point I can't do that the old things, but I'm working in this in the CFG. I'm trying to into these data foresee like the vessel of love, and we can see how the code formation at time. So how does the conclusion of the future work? Well, the in silico simulations allow the study of pulmonary microinfarctions with invasive trials. So the this computational, sorry, well, for conclusions and future work, we show our study demonstrate that in silico students can model the hemodynamic change caused by nicotine and their pulmonary microinfarctions. And we show you that the nicotine increases the vessel viscosity, reduces vascular resist, and promotes the clot formation, especially in the chronic smokers. And this computational approach represents a powerful tool to identify the risk-prone areas in the lungs and for testing preventive therapies such as coagulation or vasodilators without the need for invasive clinical trials. And well, for the future work, we explain two simulations to enlarge the patient course for better predictions. But we working in there. We work in this.